So this is a poster about replacement 25-hydroxyvitamin D calciferol in patients in hemodialysis who have secondary hyperparathyroidism. So as you know, secondary hyperparathyroidism is a very common disease in patients with hemodialysis. 25 deficiency vitamin D also common. However, as you know, in most of the patient hemodialysis, we give the active form of vitamin D. Here in our project, we try to see that what about if we give the native vitamin D, the 25-hydroxyvitamin D, to see if there's any impact it would have in the secondary hyperparathyroidism. KDIGO guidelines don't recommend any vitamin 25-hydroxy replacement in patients with hemodialysis. However, there are some articles that show that non-renal tissue is able to transform the 25-hydroxyvitamin D to 1,25-hydroxyvitamin D. So that's what we did here now in our local dialysis facility. We divide two groups of patients. One group we give them calciferol according to the KDIGO guidelines, and the other group we're not giving any 25-hydroxyvitamin D. And we measured the inclusion criteria were PTH more than 300 and the 25-hydroxyvitamin D less than 30. We follow those patients with the PTH level every 3 months and the 25-hydroxyvitamin D also every 3 months, checking the level. The study was almost for 6 months. At the end of the study, we analyzed the data, and as you can see here, it shows here that this is the results after the replacement. It shows that the people who get the 25-hydroxyvitamin D get less PTH level than the control group, which were 28 patients. However, this was not significant. We adjust the study for diabetes, for age, and for the length of dialysis. And at the end of the study showed that replacing 25-hydroxyvitamin D was not significant in patients with secondary hyperparathyroidism on hemodialysis. And we ended up in a conclusion that this replacement doesn't make a significant decrease in intact PTH level. We're planning to increase the patients in our study. As we can see now, we have 15 patients in the 25-hydroxyvitamin D and 28 will increase our patients, and hopefully we'll get more data in the near future.